Welcome back to Wave 3 Listens. We're at the Eye Care Institute with Dr. John Meyer. And Dr. Meyer, I love when there are health advances. Of course, that's great for the patient, great for the community. And here there has been a lot of movement, a lot of evolvement of cataract surgery. Previously, and correct me if I'm wrong, previously it was like a one lens fits all when you had cataract surgery. Now it seems that you can correct near and you can correct distance vision when you do the cataract surgery, correct?
That is correct. The older style lenses that we had were lenses that had one focus. You could focus for distance, and then you would depend on reading glasses for up close. Now we have lenses that are available that can take care of both. Multifocal lens technology has been evolving over a period of many years, and it's now gotten to the point where it is very good. With the multifocal implant lens, you're able to see distance, intermediate, and up close without having to wear glasses. So everybody knows when they get in their 40s, they get to the point where their arms are too short and they can't focus up close, even though their distance vision may or may not be good. These multifocal lenses will take the place of what you have lost by losing that ability to see up close. The lens itself takes care of the focusing for you, so now you have a broader range of focus, and it gives you more flexibility in what you need to do.
That sounds exciting. Now, previously, I know people used to wait before they'd have cataract surgery. Wait till you're really cloudy, wait till it's pretty far gone. Does that remain true now?
Yes, there is. There's a couple of things that are important in considering when it's time to fix a cataract. Most importantly is when you reach a point where you have some kind of impairment. No matter what level of vision you've got, if you're not having trouble, there's no need to take the cataract out. Once you get to the point where you feel like you're having difficulty dealing with your normal daily requirements, then cataract surgery is reasonable. Second kind of thing is insurance-based. Insurance companies have certain guidelines, and your vision's got to drop below a certain amount before they say it's justifiable. But once you reach that point, then cataract surgery can restore your ability to function better like you used to.
Okay, I'm going to throw you a curveball. Let's say someone out there has astigmatism. I know that was usually very unusual, something a little harder to deal with in the past. Does that remain true?
No, now we have implant lenses that can correct for astigmatism also, where before we had very few types of lenses that are available. Again, the astigmatism correcting lenses are very good. They give you the best, sharpest quality of vision that we've got with any other type of lens. So those lenses work very well for those folks who had astigmatism that have required either glasses or contact lenses to fix in the past.
Wow, this news is exciting. I would think for those folks out there who are listening to what you're saying and how it's evolved, how surgery has evolved, they're saying, you know, I don't have cataracts, but I like the sound of getting those lenses and correct my vision. Would that work for someone who, say, doesn't have cataracts, just wants to have a lens implant and get rid of the glasses?
It does.
It
would work exactly the same way. The procedure would be identical. The only difference would be whether or not you'd get any help from insurance to pay for it. If you are motivated enough and you're having difficulty with your vision, you'd like to get rid of your reading glasses, you can have a lens exchange which is essentially the same as the cataract surgery. We have these multifocal lenses that can give you that ability to see at different distances without depending on glasses. And that can be done before you have a cataract. The only issue there is that insurance won't help cover the cost of that. So if you're motivated enough, that can still be done. There are other things with LASIK and other ways that we have also of restoring your ability to function better without glasses.
Tell us, Dr. Meyer, about the team that you have assembled here at the Eye Care Institute.
We have 6 doctors in the group. Dr. Murphy is our retina specialist. He takes care of pretty much the back of the eye issues: diabetes, macular degeneration, retinal detachments. Dr. Green is another anterior segment or front of the eye doctor. He does a lot of cataracts and glaucoma. We have 3 optometrists in the group who do a lot of our routine eye care: our glasses, contact lenses, kids, family eye care. Basically, our healthy eyes are taken care of by them.
All right. So folks are watching, they're saying, I'm interested either in the cataract surgery, maybe the lens implant, maybe both, maybe all of the above. What's the first step?
First step is that we take a look and talk. There's certain measurements that need to be made to determine what procedures, or if any procedure, would be best. Those appointments are very easy to make. Telephone number here is 502-589-1500. We can set up a time to meet, talk, make some measurements, and then kind of discuss options.
Dr. Meyer, thank you very much. Appreciate it.
Thank
Once
you.
again, it's the Eye Care Institute, and we'll be right back on Wave 3 Listens.